friends, once again there's news from China about the spread of a virus. Over the last few days, many videos have gone viral on social media showing large numbers of patients in Chinese hospitals exhibiting flu-like symptoms. Reports suggest many hospitals have been overwhelmed with crowds, leading to fears that this might be the sequel to COVID-19. The novel coronavirus, which spread globally 5 years ago, originated in a market in Wuhan, China. Now, according to the Global Times, a Chinese government news website, areas like Beijing, Chongqing, Guangdong, and other parts of North and South China are seeing the highest number of cases of a virus called HMPV, the human Metapneumovirus. HMPV is not a new virus. It was discovered in 2001. Unlike COVID-19, which originated from bats, HMPV is believed to have originated in birds 200 to 400 years ago. Over time, it mutated and no longer infects birds, but can now infect humans. The virus was first identified as capable of infecting humans in the Netherlands in 2001. HMPV has been active every season, often mistaken for the common cold since most symptoms resolve on their own within a few days. Known as a respiratory virus, it causes symptoms such as fever, coughing, nasal congestion, and breathing difficulties. The incubation period is 3 to 6 days, and the severity depends on the person's overall health. While most recover within 5 to 10 days, children and elderly people are at greater risk of serious complications like pneumonia. According to Professor Paul Hunter from the University of East Anglia, nearly every child under the age of 5 has been infected with HMPV at least once, often experiencing reinfections throughout their life. The virus spreads like the common cold through respiratory droplets, contaminated surfaces, or direct contact with infected people. To protect yourself, maintaining distance from infected individuals, covering your nose and mouth while sneezing or coughing, preferably with your elbow or a handkerchief, wearing masks in public spaces, and regular hand washing are essential precautions. Most healthy individuals do not require special treatment for HMPV. Staying hydrated and resting is usually sufficient. Despite being discovered 24 years ago, there are no vaccines for HMPV due to challenges in developing safe and effective options. Unlike COVID-19, which had a higher mortality rate, the death rate for HMPV is estimated to be closer to that of influenza or pneumonia, which is much lower, whose former chief scientist Soumya Swaminathan and other experts have emphasized that this virus has been circulating in countries like India for years, with many already having some level of immunity. While some Indian media outlets have exaggerated the situation, creating unnecessary panic, experts confirm that the current spread of HMPV in China is not extraordinary. Seasonal surges in respiratory illnesses are common, and the current spike in HMPV cases in China is not as severe as last year's flu season. China's strict zero-COVID policy during the pandemic may have contributed to a weakened immunity among its population, leading to a noticeable surge in infections after restrictions were lifted. However, the situation is manageable, and there is no evidence suggesting an imminent global health emergency. WHO is monitoring the virus closely, and experts agree that the risk of HMPV causing widespread fatalities is minimal. While infants and people with compromised immunity are at higher risk, for most individuals, the infection is mild and self-limiting. In summary, while HMPV is a respiratory virus worth monitoring, the widespread panic and fear-mongering are unwarranted. Proper hygiene and precautionary measures can effectively reduce the risk of infection.